So, if we're going to be doing the lower thoracic, right, or even mid-thoracic, the differences here are subtle, but they're meaningful. So I know that there's some practitioners that will use kind of the open fist technique where they will create stiffness and contact with their thenar eminence, and then again, as I alluded to in the slide there, the spinous process is going to sit there. I consistently find that I like this grip just a little bit more. You're still going to get that additional like tractioning that I described, and the thing that I didn't verbalize that I did on the upper, and I'll show it here, is that I add, whenever possible, I add a little bit of torsion, which again, if you appreciate on my back, right, as I add a little, if I'm like this, and I add a little bit of torsion towards, right, then that's going to gap these joints, or it's going to pre-bias them into more of an open back position, which is going to allow me to get a better probability of a cavitation. The second thing here is that, similar to the technique that Kevin used earlier where he had me bridge up, here we're going to, it's not going to be a bridge, but we are going to flex from above to kind of rock and roll over that fist or that contact point to make sure that our pressures are adequate. Otherwise, the table's still going to be in its otherwise lowest position. I remain the same as far as the opposing leg being up, and then the opposite shoulder coming over. Yep, so it's just going to be like that. We're going to take up the slack without having a W, and then just appreciate that Kobe's kind of like this, and I kind of want him more like that, right, where his shoulder isn't quite up into his ear, and to help him with that, I'm going to just move the towel relative to him like that. Are you okay there? Yeah. And then you're pretty firm, grabbing your sides. Perfect. Okay. So I need you to come over towards me a little bit more. That's like another checkpoint that I have. Keep coming. There you go. Yeah. So I really want you touching me, and then I can modify the pillow accordingly. So I'm just gonna go ahead and lift up. There you go. All right. Okay. And usually they would be able to help you with their leg there. Okay. So contact point would be low if we're going for the T9 or T8, somewhere in there. And again, if this is my target segment, one, I'm kind of palpating spinous process, make sure that I'm on it, and then not like too far left or right. And then I'm going to pull down like this and create that skin tractioning. Okay, and then I'm going to pull down as I rotate him back over. Okay, and then I'm leverage him up, and then drop like that.